Okay, so today we're going to talk about medication, and so what I carry in my first aid kit. And we'll talk a little bit on over-the-counter medication. Obviously, those are the ones usually you carry in your first aid kit. But I'm going to talk about a few other things about as well. But the first thing I wanted to talk about was two different topics. But there's a lot of people carrying natural product or vitamins in their first aid kit, which is good too. But be aware that there's no such thing as a harmless substance. Everything is poison. Water can be poison. It's just a question of dose. So everything that we take, we have to know why we're taking them and how much we're taking it. Because a lot of people, I go to a conference and there's some case sometime I hear about poison control, which is just amazing. That it's just people take that as like little candy. They're thinking that, oh, it's a natural product, what can it do to me? Well, it can do a lot of harms, because some of those products are active products that we find in capsules or in pills. As well as that there's some companies there that are not as ethical as some others, and what they'll do is actually put some products. So for example, if they sell medication, say that it's against arthritis, what they'll do is actually put like aspirins in it and everything, and now you're getting yourself an aspirin poisoning. So so just be careful. So if you're gonna buy those products, go to a place that they sell reputable product and stick with that brand. And as well as talk to your pharmacist. So especially if you're taking medication, some of those vitamins and anything, they can interact with other medication and make them either less effective or too potent and have more side effects to them. So just always be everything that you put into your body, there's a reaction to it, and so be aware of that. The second thing, in my first aid kit, I do not carry antibiotics, and the reason I don't carry them is if I would go on an expedition, I would probably carry some because you're gone for 3 or 4 or 5 weeks. But in the regular 1-week trips and everything, you do not need antibiotics, because most of the things that would happen to you anyway, if you would require antibiotic, you need to get out of there anyway. And the second thing is that overabuse of antibiotics have created the superbugs that we are, MRSA, VRE, all those superbugs have created by us abusing of antibiotic. And there's even a lot of antibiotics that are becoming ineffective against a lot of disease because we're abusing of them. Especially you go see a doctor in the clinic, you got a cold which is a viral infection, and they give you antibiotic just because they need to give you something, and then you go home, you take those antibiotics, and you took them for nothing. So I do not carry antibiotic in my stuff. Do they have a place in the first aid kit? For sure. Probably for expedition, or if you really want to be prepped. But again, have a discussion with your family doctor. If you're going to go for an expedition, for example, that's what usually I do. I go to the clinic anyway because I need to get my vaccines and things like that. And so I usually go to a travel clinic. And so what we have here, it's called travel clinic, and it's basically their doctors specialize in infectious disease and all those kind of stuff. And then you tell them, for example, you're going to Nepal, and they look at what's the trend. So if malaria is high, or this, and based on that, they give you recommendations like, oh yeah, you should get that kind of vaccine, or you should take those pills, or bring those pills but don't use them. And as well as then they make me a prescription for example, Cipro. Last time I went to Nepal, that's what it was Cipro. And then I could take that, and she was telling me exactly when to take that. If you have this, take your Cipro. If you have that, take your Cipro for that. So that's all we recommend. So we're going to flip the camera, and I'm going to go talk about what I carry, and as well as the product, and something to be be careful about when you carry those. So we'll be back. Okay, so the first one will go the good old Tylenol. And Tylenol is great for pain control, and it can be mixed, especially when mixed with Advil or ibuprofen. And so Tylenol is acetaminophen, which is like the real name. Tylenol is just the brand name. So every time you buy, let's go through that quickly. So every time that you buy a medication, so for example, this is Tylenol. This is the brand name. So it's sold under Tylenol. But this acetaminophen tablets, this is the name of the product that they put inside. So basically, those tablets are made of acetaminophen, sold under Tylenol. And so if you buy like the brand name, so you know, like the no-name kind of stuff, all you're gonna have to look for is acetaminophen. Those are the 325. The only reason I bought those is just because I like the content over there. But usually, what you want is the extra strength. And mixed with this is an awesome pain control. So for pain control, it's kind of a plateau. If you take a big dose of something and bring it down, then you'll be able to maintain it with smaller amounts. Versus taking smaller amount, you're gonna kind of do like the roller coaster. You're gonna get pain, less pain, pain, less pain. So a lot of the time, what they recommend is 2 extra strengths of 1 gram of Tylenol, and up to about 800 milligrams of ibuprofen. And that stuff we give them like very safely in the hospital all the time. Obviously, you don't take those 2 every 4 hours like this, but again, it's to bring this pain right down. And then once you have your pain down, then depending on what you need. And they do 2 different things. This thing is what they call a NSAID, so a non-steroid anti-inflammatory. You know, when you start using those mnemonic and you kind of forget the real meaning. But so basically, what it is, it's a so it basically decreases the inflammation. So if you have pain like related to you have pain like, for example, for sore muscles and stuff like this is pretty good. Headache and things like that, this can be good, as well as like sometimes some tension headache, like sometimes I get a lot of tension headache. This will be good because it will decrease inflammation. So let's talk about a headache for a little while. I've been reading a lot of this. I saw a video actually pretty disturbing saying that headache are created because our blood was too thick. Well, not quite. Our brain itself has a pain sensor in it. So the brain tissue, and actually there's I'm probably going to put the link if I can find it. There's a cool video in one of the Annabelle series that he actually talks about that. It's a pretty cool video. So I'm going to try to put links to it. But there's no pain sensors on it. What it is the stretching of the vessels that creates kind of the pain. And so, for example, when we're dehydrated, those vessels get kind of collapsed and they kind of pull on it and they activate the sensors that are around there, and that's what creates the pain. As well as when we have like migraines and things like that, sometimes it's just the vessels are too dilated or too small, and so it's more the stretching of this that creates the pain. So it depends on what creates your pain. So for example, if you're dehydrated, you can take as much as that stuff, it won't help. So especially if you're high altitude or you've been hiking or something like that, drink 1 liter. In high altitude, what they say, for example, for headaches, is drink 1 liter of water. If your headache is still there, drink another liter of water and then start taking thing for pains. And if your headache is still there after that, start going down, because now you have high altitude, probably acute mountain sickness or something like this. So dehydration can create headaches, and just taking pills sometimes won't work. So what you want is you want to drink water sometime for those headaches. Some people, like for migraine as well, they'll use like caffeine, or caffeine it can help them. Yeah, and there's all kind of different ways of headache. But yeah, headache is creating because of that those vessels. And so you have to understand, and tension headaches, basically all it is basically there's tension in your neck and things like that, and because of stress, and sometimes massage can relieve your pain. So those are for headache. So let's talk about Tylenol for a little bit. Tylenol is awesome, but lately they're trying to make more money because obviously now everybody's using those things. And they have all kind of different format. They have like arthritis Tylenol, cold flu Tylenol, they have those things. So one warning about Tylenol that I wanted to make is that be careful if you're taking other products, because a lot of time now, and actually it's a big concern for the poison centers and stuff like this, because there's a lot of product that do have the acetaminophen in other products. So for example, you'll take like a product for cold and actually has acetaminophen in it, and then people, what they do, and after that they go and take more Tylenol because they have a headache or whatever, and then they take another product because they want to clear the sinus, and it has Tylenol as well. It has acetaminophen in it, and so what happened is that they overdose on acetaminophen. So this is a very big concern, and you have to be wary about that. Because too much acetaminophen, basically, because your acetaminophen is processed at your liver, and it's created by a little enzyme. And what happens is that if you take too much in a certain period of time, you run out of those enzymes. And what it does is it's got what we call a byproduct. So it's basically, it switches to a different product in your body, and that one becomes toxic, and it's mostly toxic to your liver, and you can have like liver disease after that. So just be wary when you take Tylenol. Again, there's follow what it says on the bottle, but don't forget that there's other ways that you can control your pain as well. Advil or ibuprofen, very good, but be concerned about that as well, is that there is some case reports, especially in athletes, and most of the times those are the ones that I say. If you're dehydrated or you do like very intensive workout, or like let's say you're outside in the desert or something like this, and you're sweating a lot and stuff, and you take ibuprofen, there is some case studies in the literature that ibuprofen can be dangerous for your renal function. So basically you could have renal issue. So just be careful when you're taking ibuprofen. Awesome, a great product, but if you are in a situation where you don't have access to water, or you're dehydrated or something like this, then maybe those are not as great for that. As well as, we're not even talking pediatric here, but those two products obviously can be used, but they're just be careful with the dose and things like that. As well as they can be used together, or so for example, if you take Tylenol every 4 hours, you can take like an Advil in between, because they're two different products. So for example, and both also are good for fever as well. So if you have a fever, they can be both used. And let me show you fever reducer. So, or in French it's antipyrétique. I like this one better. It sounds more stuff. But so yeah, so those two products can be used. As well as another product, and we'll go quickly. It looks like I'm going to have to do a second part to this video. Basically is aspirin. And aspirin can be used it is in the same category as ibuprofen, but has more complication for like bleed, as well as harder on the stomach and stuff. This stuff is a little bit more, but it still is, but it's a little bit less than aspirin. But aspirin I always carry as well, especially the 325 for especially like chest pain. So people with chest pain or a history of strokes and stuff like this, you can kind of give them their aspirin to load them, what we call loading them. So especially if you're going to be close to a hospital and stuff like this. So, but I won't talk too much about that. If you don't know what I'm talking about, then maybe you should take a CPR course and stuff. But aspirin can be used for that. So that's why I only have one package for that. So we'll do it in part 2.